name is Ravi Sharma, and I am the CEO and founder of OOTify. Tonight, I will share how OOTify, through a mobile SaaS application, is democratizing access to mental health care and resources. Now, I've been passionate about mental health for a long time. Over the past 15 years, I saw my mother battle severe mental illness. There were suicide attempts, but I'm happy to report she's in full remission. Unfortunately, in 2016, I had another life event, and I lost my dear friend and tennis partner to suicide. That was enough for me. Through this process, I learned a lot about the deficiencies in our healthcare as it relates to mental health in our system. I witnessed stigma that felt like discrimination at times. But you know what? My story is not unique by any means. This affects every single person in this room. According to the CDC, 50% of people will be affected by a mental illness or disorder in their lifetime. That's about 100 people in this room tonight. What's worse is that 67% of people tonight, 67% of people don't get treatment. 2/3 of primary care doctors don't even know what kind of outpatient mental health care exists. Now, this is a big human problem, but it's created a market opportunity that's about $624 billion. And we've assembled the perfect team to take it on. My background has predominantly been in investment banking. I'm also a repeat founder with 2 successful exits in healthcare and clean tech. Ironically, my largest healthcare client is right down the street called Scripps Health. We also have a chief medical officer that's a renowned psychiatrist, knows 7 different types of therapies. We have a healthcare innovator as a CTO, both with successful exits. And we also recently brought on a healthcare operator that's is helping us execute on a lot of B2B contracts that we already have in hand. Now, beyond the core team that you see on our slide today, we also have a creative team on our roster that's helped build this animated, positive brand that people can get behind and trust, both patients and providers. We also have an advisory board that includes mental health veterans and also technology advisors from Lyft, Google, Roku, and Uber. Some of them are investors as well. Now, the good news is there's a lot of money going into behavioral health right now. A lot of innovation, but the problem is they're focused on subscription model to the consumer, delayed text therapy, which is a poor delivery model. But the worst part of this, and you may not know this, is they're paying their providers minimum wage. Did you know that these independent practitioners and providers are also like small business owners? This is unacceptable to my team, and that's the difference. OOTify focuses on the patients and the providers. We help providers build a virtual practice with a consolidated technology hub that includes marketing, scheduling, and billing. For consumers, it's seamless access to clinical and non-clinical providers through either AI-assisted matching or through self-guided search. We also combine educational content and community resources, but what's really nice, and to Daniel's point earlier tonight, we're gathering psychometric data that's going to really improve AI-assisted matching, optimize that perfect fit, help with insurance reimbursement, and ultimately do the most important thing, improve mental health outcomes. Now, we do charge the providers a small monthly subscription of $50 a month, which we've discounted to $30 a month for early adopters. We also charge a nominal 7% booking fee for the convenience of using our platform, which millennials and Gen Z are very used to. But when you think about OOTify, we are a B2B play since the beginning. We've partnered up with corporations and universities to drive clients to providers. That also gives us access to corporate wellness dollars and student programming fees. So we're making moves. We launched in September of last year. We have about 200 providers on the platform with a robust pipeline. And we're announcing for the first time tonight that we've been able to secure an exclusive contract with a benefits provider that gives us access to 75 companies right here in California. One of those corporate accounts is worth $200,000 in ARR. We also have been fortunate enough to get 2 LOIs from 2 large university systems, which equates to 650,000 students and 22 campuses, where we're providing all the mental wellness programming and consolidating it for them. If that's interesting to you, would love to talk to you more about that after my presentation. Those 2 contracts are worth $2 million in ARR each. Super excited about that. Now, we're not doing this alone. We've been very fortunate to get feedback and support from the USC Marshall Venture Fund, from Thai Angels, which is one of the largest angel groups in the world, and also venture capital firms. Now, we're doing a small bridge round right now to help us execute on these contracts in the amount of $500,000. It's the minimum amount we need to execute on these contracts, help us build the provider network. And we're already 40% subscribed. We're going to close this month. Now, when you think of OOTify, I want you to think about us in three ways. We solve this problem with content to really help providers build their brand and find clients and educate users on the importance of investing in your mental health proactively. We provide technology to help with their virtual practice and make that connection process a little bit easier. And then community, because it's going to take all of us to have a sustainable impact on the mental health landscape. We think that our winning formula will democratize access to mental health care and resources, lower the cost of care for mental health, and end the discrimination that mental health sees in our healthcare ecosystem today. Now, we have a bold vision for the future of mental health care, and we'd love for you to join us. Thank you so much.